What you want to know. What you need to know. This is South Florida's Health and Wealth Radio, AM 1470, WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning. It's very, very nice to be with you this morning. This is our first show, and what I'd like to do in this show is kind of set the stage for future shows, and want this to be your show. Want you to be able to call in, ask questions pertaining to how we do what we do. We're not here to diagnose injuries. We're not here to diagnose a disease. We're not medical doctors, so we do not diagnose, but we certainly can discuss with you in great detail an alternative view of what you have been diagnosed at. So I think the very first thing that I should probably communicate to all of you is that wherever you have pain, wherever an MRI shows you have a problem, where an X-ray shows you have a problem, is where the problem ended up. It is not at all where it is coming from. So what we've done over the last 15 years is kind of pioneered a brand new branch of rehabilitation. And we coined that rehabilitation neurotherapy, not physical therapy, neural therapy. And it deals with the neurological origin of all symptoms. So, example, if you have pain in your elbow and you go to a medical doctor or you go to a doctor of any discipline, and they're going to diagnose you as having either medial or lateral epicondylitis or something of that nature. And they're typically going to treat the elbow, when in reality the elbow is where the problem ended, not where the signal causing the pain in the elbow is coming from. In neurotherapy, what we do is we identify exactly where the signal is coming from and get rid of that signal. Now, once we do that, then the symptoms that you're experiencing will go away quite quickly. Now, I know there's lots of people out there in pain. I know there's lots of people out there that have restricted range of motion, because we've dealt with over 75,000 of those people over the last 15 years. And based on our expertise in this arena, we feel very, very comfortable that we can help you. So if you have any questions pertaining to how we do what we do, where we do it, please don't hesitate to give us a call here at the station at 888-565-1470. And I would be happy to answer any questions that you might have. Now, as we are progressing through the show, I'll kind of give you some stories, some anecdotal, historical stories of patients that we've worked on and different conditions that we've worked on just to kind of give you a flavor for what neurotherapy is all about. One of the most common surgeries done in the United States and all over the world, and we are an international company, is joint replacement surgery. And up until the advent of neurotherapy, it was pretty much the only option that an individual would have is if they're bone on bone and the doctor has indicated that surgery is indicated, then typically surgery is going to be needed. However, there is now a new way of looking at bone on bone. So if you're in a lot of pain and you're bone on bone and you've been thinking about having surgery, let me just kind of give you an idea of maybe another way of looking at it. Now, we are setting up providers throughout the entire metro area, Dade, Broward, and West Palm Beach. And many of those providers are here listening to the show today. And what we'd like to do is anyone who would like to see if we can help you through neurotherapy and the ARP Wave System, then we will basically refer you into one of our providers. And if there are providers listening who are not in our provider network, we recommend that you give us a call because we definitely have patients that need providers to administer our services to. So let's talk about bone on bone for a second. It's true, if you are diagnosed with bone on bone, that obviously you're bone on bone. But that's not the problem. That's where the problem ended up. The problem is what caused you to be bone on bone. And everyone is addressing the fact that you're bone on bone. No one is addressing the question and answering the question, why? And it has nothing to do with you being old. It has nothing to do with you being overactive. What it has to do with is your muscles are not neurologically doing what they are supposed to be doing, which is acting as shock absorbers. So all that shock, instead of going into the muscle, is now going into the bone. Henceforth, you're going to wipe out all the things in between those bones, which would be fluid, which would be cartilage, which would be a variety of things. So the issue isn't that you're bone on bone. The issue is why you're bone on bone. And the answer to that question can be resolved with the ARP Wave System featuring neurological therapy. So what we need to do and what we would do in that case is our provider would identify, are you functioning correctly neurologically? And if you're bone on bone, I can almost guarantee you you're not. And so it's just another way of looking at exactly the same problem. And by looking at it in this manner, in many, many cases, you can postpone and almost eliminate any surgical need. Now, most people have surgery because they're in pain or they have restricted range of motion. So if we can eliminate the pain and eliminate the restricted range of motion, even though you're bone on bone, there's really no reason to have surgery unless you really want to. So in our network, in the provider network here in the metro area, the doctors will be able to identify very, very quickly the neurological origin of the fact that you're bone on bone, work on the neurological origin, and in many cases, almost 95% of the time, they will help you eliminate the pain and dramatically increase your range of motion and give you a quality of life that you normally would never have. How it works is this. We identify with a very, very simple test where we check your muscles to see, are they absorbing force? So in other words, it's like a mechanic checking your car to see if your shocks are working. If your shock absorbers are not working on an automobile, you're going to have a rough ride just driving around the metro area. But if you drove from the metro area to Alaska and back, you're not going to have a car. And the reason you're not going to have a car is because all the force that's supposed to be going into the shock absorbers is now going into your frame. So with that force going into the frame, the car isn't designed to absorb that force, just like your body is not designed to absorb force anywhere except the shock absorbers, better known as muscles. So if those muscles are not working efficiently neurologically, you are going to have a problem. I'm not talking about the strength of the muscle. I'm talking about the muscle's ability to absorb force, which is kind of a foreign concept because most people say, I'm really strong and, my legs are strong, but my knees kill me. Well, the legs are strong. That doesn't have anything to do with your knees. If your knees are bothering you, the reason they're bothering you is the muscle, which is very, very strong, isn't absorbing force. So if a muscle cannot absorb force, you are going to have force going to tissue that's not designed for that force. Example, tendons, ligaments, cartilage, and bone. None of those items are designed to absorb force. There's only one place in the body that absorbs force, and that's muscles. So if you have a joint problem, you really don't have a joint problem. You have a muscle problem. And it's not a muscle problem because you're not strong enough. It's a muscle problem because the muscle is not able to absorb force. And again, it's just that simple. So if you begin to look at everything that goes on in the human body, and you look at where pain ends up, and you look at all the joint problems that we have as a nation, and you just simply turn that whole spectrum around and ask yourself, where is the signal coming from? And if you can answer that question, you can solve the problem. Unfortunately, our skilled doctors have been trained in physical medicine. No one, and I mean no one, addresses the neurological origin of that signal which is causing the pain. And that's exactly what we do with the ARP Wave System. And it's a very, very simple system to use. We train our providers throughout the world, and again, we're looking and reaching out for doctors who are interested in treating more patients. We're interested in providers who are interested in alternative ways of addressing pain. We're looking for providers who are interested in working with elite top-level athletes, because we have over 600 NFL players. The Miami Dolphins, as an example, we have many players on the team who are clients of ours. So with that in mind, I hear the bumper music starting to start in the background here. We're going to take just a short break, and then we'll come back, and if we have some callers on this first show, I'll be happy to answer any questions, and you'll get a flavor for the entire process of the ARP Wave System.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back, and hopefully I've given you just a little bit of information to kind of spur the thought process, because what I'd like this show to do for not only the providers listening, but all of the potential patients and interested parties, is I'd like it to spur interest, not just in the ARP Wave system, but just causing you to think, because all of us traditionally have been led down the path that says wherever it hurts is where I have to treat it. And everything that we do traditionally in therapeutic medicine is addressing where the problem ended up, not where the problem is coming from. So with that in mind, let's talk about how the system works and why it works, and what's the difference between the ARP Wave system and any other type of therapeutic system. So let's start out with, what is the ARP Wave system? Well, the ARP Wave system is a three-part system, and if one of those parts is missing, the system does not work. The key word is, it's a system. And the first thing that we have to do is identify immediately, is the nervous system sending the right signal to the muscles to allow them to absorb force? Because if the nervous system is not sending the right signal, then unfortunately you're going to have pain, or you're going to be at a high risk for having pain or injury. So let's look at that, and how do we do that? Well, everybody's heard, or most people have heard, certainly all of our providers have heard, about a technique and a imaging type of program that's called an EMG, which stands for electromyograph. And what an electromyograph does is it basically tells us, is there a nerve signal that's not interrupted? If there is a nerve signal that's not interrupted, then there's no neurological problem in that test. However, that test does not tell us if that nerve impulse is strong enough to fire the muscle fast enough to allow the muscle to absorb force. I'll give you an example. I was working on a professional athlete probably 10 years ago, and this person was extraordinarily strong for his size. He was about 6'2", about 215, and he could squat a little bit over 650 pounds and bench press over a little bit over 500 pounds. But he could not run 50 yards without tearing up a hamstring. And he was constantly plagued with injury. And everybody was completely baffled and just said, well, the guy's just, he's prone to injury. There is no such thing as prone to injury. There's got to be a reason. So if we have a problem, there's always got to be a solution. Trust me, there is always a solution. So this individual came to me and was referred to us by another player. And the first thing I did is laid him down on a treatment table, raised his leg up, and I said, now I want you to resist. And I want you to use all the resistance power you have. And I took one finger and pushed his leg down. Now, this is a guy that squats 600 and some odd pounds. Now, to say the least that he was completely exacerbated by what just happened, he did not understand that I wasn't testing his strength. I was testing to see, could he absorb force? Now, he couldn't even absorb the force of me pushing down on his leg, but yet he could squat 600 pounds. So you can see the disconnect there. We think that we're strong, which we are, but strength doesn't equal ability to absorb force. And unfortunately, pain and injury is a direct result of the body's inability to absorb force. So you can see what a huge disconnect that is. So in the test I gave him, I told him, look, I'm not testing to see how strong you are. I'm testing to see, can you absorb force? Now, at 6 foot, 200 and some pounds, every time he takes a step, he's absorbing about 3 to 4 times his body weight. Every time he runs, he's absorbing 6 times his body weight, 4 to 6 times. Now, if he can't absorb the force of me pushing down on his leg, do you think he's going to be able to absorb the force of running? Absolutely not. So once we identified that he couldn't absorb force, then with the ARP Wave system in the first step, we had to turn back on the nervous system. And the way you do that is a technique that we've created at the ARP Wave company. And that system is what we call neurological imbalance. Now, many of you have probably had chiropractic adjustments in the past, and the chiropractic adjustment basically elevates the ability of the body to absorb force, but it's doing it by manipulating your spine. And by doing that, you send a flood of information into the body, and the nervous system picks up on that information, and then a wonderful thing happens. The muscles are now getting a spark, and so they begin to fire again. But the problem with that is they don't stay in that position because we go back out and we do the same thing that we've been doing all along, and now we go right back to the same pattern. So we constantly have to keep doing that over and over and over again. What we do in the ARP Wave system in step 1 is we basically neurologically adjust your nervous system by sending a mimicking signal to your body, into your body, which immediately changes the muscle's ability to absorb force because it raises what's called, and many of the providers will understand this language, it raises what we call the central integrated state. Now, for those of us who aren't in the medical provisions, typically what that means is this. Think of yourself as a spark plug. As a spark plug, if you're gapped incorrectly, in other words, that little tiny space between the plug and the firing mechanism isn't gapped right, you don't fire the gasoline so your car doesn't start. Well, your body's the same way. So if all we have to do is adjust the nervous system, just like you adjust a spark plug, and when you make that adjustment in the nervous system, now the nervous system will fire the muscle. The muscle now will be able to absorb force. The force will be transferred to the muscle out of the damaged tissue, and now you have no pain. And that's step 1 of the nervous system, getting the muscles to neurologically fire. Now, no amount of physical therapy, no amount of rehabilitation is going to do what I just said, which is increase the central integrated state of the nervous system to fire the muscle, to allow the muscle to absorb force. That is why the ARP Wave system is so incredibly unique and is a new therapeutic venue. And again, that therapeutic venue I've called neurotherapy, not physical therapy, neurotherapy, because we're dealing with the neurological origin of the physiological symptom. So step 1 in the system is designed to get the nervous system firing the muscle so the muscle can absorb force. So going back to our athlete, We now have the individual who cannot absorb any force at all. So we do a simple technique by which we basically re-implement the very first thing that individual ever learned how to do on their own, which is called crawling. The first thing that all of you listeners learned how to do cognitively on your own, which wasn't hardwired, was how to crawl. And the way you crawl is right side drives left, left side drives right. So it's the first basic cognitive reflex pattern that we learn how to do as human beings. Well, if you can't absorb force, I found that you have to stimulate that reflex pattern. So you have to re-implement it. So I'll ask you a question. Has anyone ever had a computer that went blue screen? Just crashed. And everybody will say, well, yeah, I've had that happen. Well, what'd you have to do? Well, you have to turn off the computer. That's number one. Number two, you turn it back on. Number three, you have to reset it back to its original settings. And the way you do that is there's a technique on the computer that says reset back to original settings. You're going to lose the data that you had earlier if you didn't back it up, but it's going to bring your computer back to its original settings. That's exactly what we do in step one. We basically re-implement your first reflex pattern, which is called cross-crawling. And by doing that, we are now telling the muscles that they're able to work efficiently, even though they're not. We're telling them over and over and over and over again that they are. And in a period of 3 to 4 minutes, we have got the muscles reset back to their original settings and allowing you to absorb force. And folks, trust me, there is absolutely no other way of doing what I just said other than the ARP Wave System. And what we do with our providers is we teach those providers this technique. So step one is simply turning back on the nervous system to allow muscles to absorb force. So getting back to our player, a very, very, very strong professional athlete, but that very, very strong professional athlete could not absorb force. So now we do the technique, which takes anywhere from 3 to 4 minutes. And at the end of 3 to 4 minutes, then we test again, because we have to see, did it work or didn't it work? So while they're going through those 3 minutes, we have electrodes. We're strategically located on the body, sending a neurological signal directly to the muscles, telling the muscles that they're absorbing force and they're working correctly. This is why we are so incredibly successful with things like quadriplegia, paraplegia, stroke victims, spinal cord injuries, concussions. Just because MS, just because your brain can't tell your muscles what to do, does not mean an external brain can't. And so think of the ARP Wave system as one of the tools is an external brain, which mimics the body. And that external brain is what's saying to the muscles, yes, you can now absorb force. And as we go through that process, in those next 3 minutes, the end result is the body can now absorb force. Well, I hear our bumper music. This is a good time to take a break right now. We'll come back with step 2 of the ARP Wave System.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website, www.painmanagementnetwork.com, and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, thank you very much for coming back. Now, we've talked about the first stage of the ARP Wave system. Now we're up to stage 2. And stage 2 is basically fixing all of the damage caused by the system not working correctly. So in other words, if the shock absorbers aren't absorbing shock, the shock is going to someplace they're not supposed to go. The shock absorbers in this case are your muscles. So if the muscles are not absorbing the force, then the force has been going to joints, tendons, or ligaments, henceforth causing a problem. So just as though a mechanic has to fix damage caused by the shocks not doing their job, in step 2, we have to fix the damage caused by the muscles not doing what they were supposed to do. So in step 2, what we do is we have to identify what muscles failed to do their job, causing the problem that we're experiencing. So using the example of our athlete that we used in step 1, now we've got that athlete's body able to absorb force. Now this is not just for athletes. If you're bone on bone and you're 85 years old and can't walk, you have exactly the same situation as this individual who's a professional athlete did. Your muscles are not absorbing force. And if they can't absorb force, the force has got to go someplace. That's just pure physics. And it's going to go to your joints, or it's going to go to your tendons and your ligaments, and you're going to have pain. So let's get back to our example. With our athlete, the first thing now that we did is we got the muscles to absorb force. So now what we have to do is find out why they weren't absorbing force to begin with. So we use a technique that we call cellular disruption location. And here is the heart and soul of our system. And for the providers that are listening, basically what we're looking for in this specific stage is we're looking for an electrical disconnect. So for the non-providers listening, which is the overwhelming majority of people, I'm sure, I'd like you to think of yourself in, instead of being a car, because we had you thinking of yourself being a car in the first set, now let's have you thinking of yourself as, let's say, a television set. So as a television set, you're now a TV. And if there's a short in the television, does the TV work? And of course the answer is no. So then the next question is, does it make any difference where the short is? And again, the answer is no. Well, newsflash. Your body is just like an electrical television. And if there is a short anywhere in your body, your system is not going to be working. It's got an electrical short. So think of cellular disruption location, or some of our professional athletes like to call it search and destroy. Think of it as this. We're looking for the electrical short. And to do that, we're going to strategically use the second part of our system, and a very, very unique tool that we use to start the nervous system, which is the ARP Wave itself. We're going to use that tool, and we're going to identify using that tool, which is highly proprietary, patented by us. There is no other tool like this in the world. And we're going to use this tool to find out where the short is. Now, how do we do that? Well, the first thing we do is we ask the patient, where does it hurt? I have never seen a patient out of 75,000 patients who didn't know where it hurt. We don't need an MRI to tell you where it hurt. We don't need any type of imaging to tell you where it hurt. You already know where it hurts because it hurts right there. And you can pinpoint exactly where it hurts. So the first thing that we do is we take an electrode and we place it right on that spot that hurts. And then we take another electrode and we put it completely on the opposite side of your body and get it out of our way. We're grounding it out of our way because we know that where you feel pain is not the problem. It's where the problem ended, but it certainly is not the problem. So with that in mind, we have the electrode now where you've directed us, and we turn up the power to a designated level. And as we're turning up the power, we're going to ask you what you're feeling, sensation-wise. It will not be pain. Trust me, it will not be pain. But there'll be a sensation. Could be a tingle, a buzz, a hum, could be anything. But we need to know the intensity of that feeling that you're feeling. 1, we tell you, is very, very low. You can barely feel it. 10 is very, very high and could get uncomfortable. What we want to do is find out from you what you're feeling. So as you're working with us or working with our provider, typically what the provider is going to be doing is turning up the power on our proprietary tool called the ARP Wave. And as we're doing that, we're going to get feedback from you. You're going to be telling us what you're feeling. So let's say we get the power up to a designated level and we ask you, okay, what do you feel in that spot? And you'll say, well, 10 is really high, 1 is really low, so I'm feeling probably around a 3 or a 4. So what that's telling us unequivocally is where we have that black electrode, where you directed us to put the black electrode, is not the problem. And we're going to tell you that point blank. Now, most of you have already seen myriads of different providers. And those providers have all treated you right where you just told us to treat you. So now we're going to move that electrode, and we're going to give you some instruction. We're going to say, look, as we move this electrode over your body, we're looking for a spot that is more intense than the spot originally where it is right now. And we say, as we move it, you just tell us if it goes up in sensation or down in sensation. Now, think of it as like a scan. We're scanning your body, looking for, medical terminology, we're looking for cellular disruption location. Layman terminology, we're looking for an electrical short. So as we drag this electrode up and down your skin, let's say that we originally started, and we'll use our professional athlete as our example. His big issue was his hamstring. So we put the electrode on his hamstring, and we turned it up, and there was nothing there. And as I started moving the electrode up and down the hamstring or the back of the leg and all the way down the calf or the back of the leg and all the way down into the foot, nothing, and it was on his right side. Absolutely nothing. Nothing increased sensation. I then moved the electrode over to the opposite side of his body. Now keep in mind, all the pain is on the right side. I'm now on the left side, on the bottom of his foot, on the left side, and guess what? That was the spot where the electrical short was. That was the spot where there was cellular disruption, and that was the spot that created a significant change in the sensation on the electrode. So I said to him, this is where your problem is coming from. Your knee, or hamstring, is where the problem ended up. Now that's really hard for somebody to wrap their head around. My hamstring on my right side hurts, but they're treating my foot on the left side. Very difficult to understand. However, everybody else was different. So the proof will be in the pudding after we go through the treatment. And that's what I said to him. This is where the problem's coming from. Do you want me to treat you where you pointed to me, or do you want me to treat you over here? Which makes more sense to you? Well, what do you think he said? He said, obviously, treat me over there where you feel the problem is coming from. So now we take this second electrode and we move it right back to the place where we started the first electrode. And we turn the power up to exactly the same setting we had it earlier. Why do we do that? Because there can't be any differentiation in identifying. If you turn the power up higher, you're obviously going to get a different response than you turn the power to exactly where it was before. You always want to have a baseline. So now we turn the power up to the designated level, and we just simply say to the patient, which is more intense, when the electrode was where it was originally or where it is right now? And in almost every single case, it's going to be where it was originally, not where it is right now. So now we say, okay, this definitely is not your problem. This is where the problem is ending. So now we take that electrode and we start mimicking the same path that we just did with the other electrode. So we're going to go up and down the hamstring, down into the calf, down into the foot on the right side, all the way across the lower back, upper back, shoulders, arms on the right side, and we don't get any intensity at all. Now we go over to the left side, we go into the hamstring on the left side, we go all the way down to the calf, gets a little bit more intense. We go up into the hip flexor on the left side, and all of a sudden he said, oh, that's a whole lot more intense. Okay, so we say, all right, where we have the first electrode's where it's coming from, where we have the second electrode is where the signal's ending up, and where we had the original electrode where the pain is where the problem ended up, not where the signal is coming from. Where the signal is coming from is your toe on the opposite side. So, as we identified exactly where the neurological signal was coming from, the next thing we have to do is treat. Now, how do you treat someone for a hamstring problem? How do you treat someone for bone on bone in the knee? How do you treat someone with carpal tunnel? How do you treat someone with medial or lateral epicondylitis? You treat them where the tool told you to treat. And that's the only place we ever treat, is where the tool, the proprietary tool, tells us where to treat. And so providers, the very difficult thing for all providers is they know where the problem is. We're showing them where the problem is coming from. So it's a difficult leap to treat somebody in the big toe for a hamstring problem on the right side. Well, I hear our bumper music coming. When we come back, we'll talk about how we treat. And then by that time, it'll be time to wrap up. So I will let you go for just a few seconds here, and I'll be right back.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida Provider Network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
How much time we got left, Joe? Okay, I think we are back. And Joe, I'm going to ask our producer, who's doing a phenomenal job. This is the first show, first time I've worked with him. Joe, can you kind of give me an indication of how much time we have left here on the show? Oh, okay. Let's have Frank come on board, and we'll try to answer his question. Frank, are you there?
I'm here.
What questions do you have, sir?
Well, I've got some hip problems.
And how's it been diagnosed?
Well, they said that I need a replacement. I've already had one. Now they said I need another replacement because the joint has worn.
Okay, so let me ask you this, Frank. If the original hip replacement would have been the answer to the question, do you think you would need another one?
Wait a second now. That's interesting. You don't know me, and I didn't give you any history on my hip, but you see, the hip that was replaced, that bothers me also.
And when you had the replacement, did the doctor tell you that 10, 15, 20 years from now you'll probably need another one?
No.
Because that's the normal course of activity. The hips are getting the parts used are getting a lot more sophisticated now. But it used to be 10 to 15 years, and you would basically wear out the new hip. Now, if you stop and think about that a second, how is that humanly possible that you would wear out a brand new hip in that short a period of time? Well, the answer is quite simple. The answer to the problem was not getting a new hip. The answer to the problem was finding out why you needed a new hip. And the answer to that question is what we've been talking about this morning, and that is your muscles, Frank, are not neurologically absorbing force like a shock absorber, so all the shock is going to your hip. Does that make sense to you?
Yeah, okay. That makes sense, but who's going to teach me how to move? Who's going to, I don't understand how that might work. I walk, I raise my leg to go up and down stairs, and are you saying that I'm just moving wrong? And how is what you do going to help me long term?
That's an excellent question. You brought up three very, very important points. Who's going to teach you how to move? Are you moving incorrectly? And what's this going to do long term? Well, let me give you the answer. First off, you already know how to move. You just can't move correctly because it hurts, and you created a pattern. Example, if it hurts on the right side, you're going to move everything over to the left side. We call that a compensation pattern. Okay, you become used to moving that way, whether you have pain or not, because that's your pattern. So the first thing that we have to do, like we talked about earlier in the show, is we have to make sure that your nervous system is sending the right signal to your muscles to allow them to absorb force, to act as shock absorbers. In your case, they're obviously not, otherwise you would not need a new hip. So we can already rule that out. So then what we're going to do is we're going to transfer the force away from your new hip joint and your old hip, and we're going to put it back into the muscle. Now, once that force has been transferred from your joint or your artificial joint back into the muscle, you're not going to have pain. More importantly, in the process of the treatment, we're going to teach you neurologically a new pattern of movement. And without that new pattern of movement, you're going to be right back to where you were before. So to answer your question, A, we're going to transfer all the force out of your hip, artificial or not artificial, into the muscle, therefore eliminating the pain, therefore eliminating the signal going into the area where you experience pain. We're going to increase your range of motion, and we're going to change the way you move and walk. How? Well, we're going to neurologically train you, neurologically re-educate you on how to move efficiently, and that's all done in the treatment. Frank, let me ask you a question. Does that sound like something that makes sense to you?
Hang on. I have a question for you. How many years is this going to take? You know, I'm getting old. I don't know how many years I have left. This sounds really complicated.
Well, you know, Frank, that's a fabulous question. What would you do if I told you it's going to take 10 days?
I'd say, what the heck did I do with my doctor prior to this? 10 days? I mean, I messed
Exactly.
for years.
Exactly. And that's why we're having this radio show. This radio show is designed to get folks like you thinking just what you just said. Is there another way? Not a better way, not something radical. Is there another answer to a potential problem? And of course the answer is yes. Frank, we've treated over 75,000 patients with better than a 95% success rate. Our providers that we're setting up in the metro area, in the 3 counties of Dade, Broward, and West Palm, will be able to address this exact same situation in 10 days or less.
Okay. Are you going to be giving the contact information for this so that I know who to contact and I'll, get this?
Absolutely. You can contact locally. Call 954-256-0045, or you can go to Pain Management Network, all one word, painmanagementnetwork.com. And they will refer you to one of our providers immediately. The very first session to prove to you what we're saying is true is absolutely no cost to you whatsoever, and the treatments are covered by your insurance. So you've got absolutely nothing to lose but your pain.
Well,
and I thank you so much for the call.
Can I ask one more question?
Sure, absolutely.
Does this hurt? Because neurological sounds like it'll hurt.
No, it doesn't hurt. Typically what's going to happen is we're going to work within the parameters of what you say your sensitivity level is. It doesn't have to hurt. We could treat you where you don't feel a doggone thing. However, if we do that, you are not going to get stronger. You are not going to break a pattern. So we need to get the stimulus high enough to where it can make a change. And everything we do in our system is based on a very, very simple premise. That premise is, number one, all pain has a neurological origin. All injury has a neurological origin. And, more importantly, the way to break a pattern is the greater the stimulus, the greater the change.
All right. Are you going to have these shows regular so I can call in?
We're going to have these shows once a week, every Monday at 10 o'clock Eastern Time over the next year. This is our very first show.
All right. Well, I got tuned into it. A friend of mine called me and said, hey, I should listen to this guy, so that's why I called in. All right. I've got the information. I'm going to give them a call, And then
All
I'm
right.
going to follow
Appreciate it. Thank you, sir.
Let you know. All right.
Yep. So just as Frank was saying there, with hip problems, as we look at surgery throughout the world, the number one surgical intervention done anywhere in the world right now is joint replacement surgery. And the number one population it's done on is baby boomers. Well, the baby boomers have kind of controlled everything that they've been involved in since they came onto the planet. So typically what we're doing right now is we're addressing a very, very simple premise, and that is this: wherever there is pain, there is an electrical disconnect. So now we're going to get back to where we left off and how we do the therapy. We do the therapy by neurologically stimulating you to move efficiently in a pattern that breaks your old pattern. Next week, we'll get deeper into exactly how we accomplish that. And if you have any questions, please don't hesitate to give us a call here at the station at 888-565-1470. Or if you'd like to ask a question for next week's show, write into painmanagementnetwork.com. And thank you for your time.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.